Chapter 5. Using the imported data to complete the audit worksheet. The audit worksheet can be found on the diabetes website given below. Scroll down to reach the audit form in editable and image format and press Download File. Save this file into the diabetes_spreadsheet folder that you have previously created. Once saved, you are ready to fill in the audit worksheet. To complete the audit worksheet, select the first patient on the diabetes analysis spreadsheet. Using the patient's details, log on to EMIS and find the patient to look at their medical record. Once you've identified the correct patient, you can then navigate back to the audit worksheet and complete the boxes using the patient's medical record on EMIS. An example of a misclassified patient. This patient has been diagnosed with type 1 diabetes mellitus. To verify this diagnosis, have a look at this patient's values, looking at their HbA1c levels, their fasting blood sugar levels, and their body mass index. You will then need to record all of those values in the audit worksheet, both at diagnosis and the current readings. Next, look at the patient's medications, taking note in the audit worksheet when they were first started on this medication and when they were last prescribed this medication. For example, this patient is prescribed insulin, metformin and pioglitazone. After filling in the audit worksheet for this patient, it is clear to see that this patient has a diagnostic issue with their diabetes. After looking at this patient's details and the medical records, it is clear to see that there has been a change in the diagnosis of diabetes. Prior to the audit, they were labelled as being type 1 diabetic. However, after the audit has been conducted, they are actually type 2. This is therefore an example of a misclassified patient. An example of a miscoded patient. Select the next patient on the diabetes analysis spreadsheet to have a look at their medical records on EMIS. This patient has been coded as having other specified diabetes mellitus. Again, look at the patient's values, taking note of their fasting blood sugar levels, both at diagnosis and the current reading. Looking at their HbA1c levels, again, both at diagnosis and the current reading. And finally, looking at their body mass index. And now look at the patient's medications. For example, this patient has been prescribed metformin and pioglitazone. Once again, fill in the patient's details into the audit worksheet. Looking at this patient, they have had a change in diagnosis. This patient has been given a number 8, which indicates a vague code. This can then be changed to type 2 diabetes, and this is an example of miscoding of diabetes. An example of a misdiagnosed patient. Work through the data analysis spreadsheet to identify patients with possible diagnostic issues. For example, the next patient has been diagnosed with type 1 diabetes mellitus. To verify this diagnosis, have a look at the patient's values, taking note of the HbA1c level. Next, look at the patient's body mass index. And finally, look at the patient's fasting blood sugar levels. Next, look at the patient's medications. This patient is only being prescribed metformin. This therefore does not satisfy the criteria for the diagnosis of type 1 diabetes mellitus. In the audit worksheet, this patient had normal biochemical readings and was only being prescribed metformin. This patient has therefore had a change in the diagnosis of diabetes. Prior to the audit being carried out, they were labelled as type 1 diabetic. However, on looking at their biochemical markers and the medications that they are currently on, we can see that this patient has been misdiagnosed with diabetes. Using the current NICE guidelines and papers published by Professor Simon de Lucion on the misclassification, miscoding and misdiagnosis of diabetes in primary care, you can find out how these patients have been miscoded, misdiagnosed or misclassified. The 3 patients that have been mentioned have been examples of misclassified, miscoded and misdiagnosed patients with diabetes in primary care. The series of videos has illustrated how to use the MyQuest data extraction tool on EMIS LV systems in order to highlight those patients with a misdiagnosis, misclassification and miscoding of diabetes in primary care. Accurate classification of disease for diabetes is vital for effective disease management and quality of care.